Hi, everyone, and welcome to the 55th episode of Battles and Voices. I'm Lathika, and I'm the founder and host.
And I'm Camden, and I'm the co-host, and we serve on the executive team of Vitals and Voices.
Battles and Voices brings together generations of people involved in healthcare in order to foster a supportive and connected community.
Please welcome our guest, Miriam Samekhova.
Hi, my name is Miriam Samekhova, and I'm a family nurse practitioner and an owner of a primary care office here in New York. We go by the name as Metro Family Health. Nice to meet you.
Thank you so much, Miriam, for joining us today. We're so excited to have you on Battles and Voices. To start us off, feel free to introduce yourself and tell us a little bit about what you do.
Okay. So I am a provider here at our practice, Metro Family Health. We provide comprehensive, compassionate care across a lifespan from pediatrics to geriatrics, with a strong focus on preventative care and making healthcare more accessible to patient-centered. I also run my practice with a mix of insurance-based and cash-based services to help the patients meet, to help the patients meet where they are.
That's incredible to hear. So you've said that you built a career centered around long-term patient care relationships. What internally inspired you to enter healthcare in the first place?
So I was drawn to healthcare because I've always been deeply interested in people and their stories, specifically their struggles and how health impacts every part of their lives. Over time, I realized I didn't want to just treat their symptoms, but actually build a long-term relationship with the patients and advocate for them. That led me to a family medicine and eventually opening up my own primary care office where I can practice medicine the way I believe it should be practiced, thoughtfully, compassionately, and without rushing patients through their concerns.
I honestly love that. So, I know you mentioned this in your answer, but you've said again that you didn't want to just treat symptoms, but truly advocate for your patients. How did that mindset lead you to family medicine and overall eventually opening up your own practice?
So, just a little, I guess, background. So, when I first became a nurse practitioner, I did work in a primary care office for pediatrics, and I did do house visits for geriatric patients, and seeing their chronic conditions and diseases kind of led me to where I am today, opening up a family practice, focusing on preventative medicine. So, this is how I ended up choosing internal medicine and focusing on preventative medicine as opposed to just treating the patient and their symptoms, but actually preventing it from getting that far.
That's incredible work that you're doing then with the preventative medicine and and oh my gosh, intertwining it with your business as well. And so owning a primary care practice gives you a lot of autonomy, but also a lot of responsibility that comes with that. What has been the most rewarding part of running Metro Family Health?
The most rewarding part of running my practice and seeing my own patients is actually getting to their goals, and helping prevent, again, the chronic long-term diseases that we see a lot here, like hypertension, diabetes, and even some cancers. So through the preventative care that we offer for our patients, such as reminding them to do their screenings or just their yearly blood work and their follow-ups, that's actually the most rewarding part, is being able to manage their health as a whole before, seeing them, God forbid, getting sick with the chronic diseases that we don't want our patients to be getting diagnosed with. And a big struggle, I would say, with actually getting to our goal is actually having the patient being compliant. But we're working on it with them. We do a lot of follow-up televisits and phone calls when the patient isn't able to come face to face and see the provider. So we do offer televisits, and that's kind of bridging the gap.
I love how you're able to kind of overlook and see all the aspects of your patient's health. I really like, when physicians and nurses and like all healthcare professionals just put in a lot of empathy into their work. So, you're doing really amazing work, Miriam.
Thank you.
Of course. So healthcare can be emotionally and physically demanding. What motivates you to keep going every day, especially during those challenging moments?
Seeing my patients actually thrive in their health and leaving the office with a smile and actually happy that they're um, part of the population that's very healthy and changing their lifestyles and seeing a change in their health once they do that, even simply with just diet and lifestyle modifications, that kind of gives me the motivation to keep going because I do see a change in the patient. And likewise for the patient, they keep coming back, and it's rewarding to see that.
That's so beautiful. And I love that you're like thinking of your patients again with the empathy is incredible. So you've also mentioned how meaningful small moments can be from the smiles of them like leaving the office and also from reassuring patients to catch issues early on. Can you share an example of a moment that reminded you why you do this line of work?
Yeah, sure. So just, I guess a little example. We had a patient coming in thinking, I'm healthy. I don't need to do the blood work, or, um, I don't have any symptoms. And it's just simple as checking their blood work and seeing that their A1C was elevated and they had no idea and no symptoms. And we were actually able to treat it early, before they had to get to that level where they would have to be on medication, and see any, symptoms about the actual diabetes aspect of it. So that's just a little story that kind of helps me push through it. So even though the patient doesn't think there's anything wrong, you won't know until you actually come to the physician's office, get your physicals done. And again, here at Metro Family Health, we're very into preventative medicine. So actually pushing the patient to get their yearly physicals, to do their preventative screenings is what we actually push for here, as opposed to waiting till it gets to the chronic aspect of the diseases.
I love that. So, you mentioned before that you're deeply passionate about preventative care and patient education. Why do you think this area is so critical in today's healthcare system?
Because we do live in a crazy society right now where a lot of patients are struggling with anxiety, with depression, with, again, high blood pressure, with diabetes, obesity. And our goal here is to just prevent the patient from getting to the late stages of these disease processes. So that's why we really thrive to just do all the screenings. Even there's just simple screening tools that they do by hand to measure the patient's risk of getting anxiety and depression. And even these small little tools we try to implement just to make sure the patient doesn't reach those reach reach those chronic diseases. We try to catch them earlier on.
Alrighty, that's amazing. And how do you help your patients feel empowered to take an active role in their health, especially women and busy families who often put themselves last?
This is actually a good question, and this is why I really, my main goal was to actually see pediatrics and adults. This way, when the mom brings in her kids to see the physician, we actually offer the mom to be seen as well. This way, she can put herself first and not just come in to see the physician for her children, but actually make sure she's getting cared for as well. So it's like a one-stop shop, and she can bring her children, get them screened, and herself as well.
I love that. So, building a practice while balancing motherhood is definitely stressful and also rewarding. How has being a mom shaped the way that you practice medicine and connect with your patients?
Being a mother of four actually did um, was a very big struggle, especially in the patient's aspect. I being a mom really taught me how to have a lot of patience and stay calm, especially in those moments where everyone is so loud and it's so hectic and there's a million things going on at once. So being a mom really shaped me to being a good provider by just keeping my cool, staying calm, collective, and having a lot of patience and hearing out what the patients have to say to me. And this is the same values I have towards my children as well. So staying calm and just listening to what they have to say, and being a mom really did shape me into a good physician.
And to wrap things up, what advice would you give to healthcare providers or students who want to practice medicine in a more patient-centered and innovative way?
I would say it's definitely a struggle to open up your own practice. You really need to have a lot of patience, and really need to have a big support system. So I can't give all the credit to myself. I do have a big support system. That's my mom, my husband, my family. They do help me with my family and my responsibilities outside of work life, so I can focus on being a great provider. So the best advice I can give is that it will take time and don't give up, because at the end of the day, it's worth it.
That's some incredible advice, and thank you so much, Miriam, for sharing your journey and offering insight into patient centered care, preventative medicine, and leadership and primary care.
Thank you. Thank you for having me.
Thank you for joining us today. Your story was definitely a powerful reminder that healthcare is about relationships, trust, and meeting people where they are.
And to everyone listening, thank you so much for joining us on today's episode of Vitals and Voices.
If you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes of Vitals and Voices.
We'll see you next time.